Welcome to our guide on postoperative care following third molar extraction surgery. It's crucial to follow these instructions to ensure a smooth recovery and avoid complications. Let's start with some essential tips to protect the surgical site. Bleeding control. Do not use a straw or spit for 48 hours after surgery. This will encourage bleeding. Contact us if bleeding does not resolve by the next day. Most bleeding stops or decreases to a slow oozing on the first day. Occasionally, bleeding persists to the next day. Gauze packs provide pressure on the extraction sites, which helps to slow and stop bleeding. This is accomplished with constant, firm, biting pressure on the gauze pack. Gauze packs must be properly placed to be effective. After surgery, your surgical assistant will review the proper technique with you prior to discharge home. Try to time your consumption of clear liquids with scheduled gauze changes. Swelling control. Facial swelling will slowly develop over the first 48 to 72 hours. The swelling will then slowly resolve and usually lasts 5-7 days. Keep head elevated, head above the heart, for the first 48 hours. Sleep with head elevated for the first 2 nights. Use ice early and often with 20 minutes on and 20 minutes off. Use ice up to 48 hours after surgery. Pain control? Take your medication as directed. Do not take any other prescribed or non-prescribed medications without discussing with your UC doctor. Diet. A clear liquid diet is recommended for the first 24 hours. The next day, a soft diet is usually well tolerated. Clear liquids are liquids you can see through and are free of pulp. Examples include broth, apple or cranberry juice, Jell-O, Gatorade, tea. Good soft food examples are yogurt, ice cream, eggs, pancakes, mashed potatoes, protein drinks. Drink plenty of fluids after surgery. This helps prevent an upset stomach and dehydration. If your jaw is stiff, remain on a very soft, limiting chewing diet until the jaw muscles begin to relax. This helps decrease the chance for jaw muscle spasms. Avoid hard, crunchy foods such as chips, seeds, nuts, and popcorn until the wounds are healed for up to 6 weeks, as they are prone to stick in the wounds and may lead to infection. Oral hygiene. Do not rinse your mouth or brush your teeth the first day. The day after surgery, if the bleeding has stopped, begin warm salt water rinses. Use only 1/2 teaspoonful of salt per glass of warm water. Add a minimum rinse after every time you eat or drink anything that is not water, and at bedtime. You may also rinse between meals if desired. If salt water is not available, use plain tap water. Continue rinsing until the wounds are healed. This may take up to 6 weeks. Resume toothbrushing with toothpaste the day after surgery. Common sense dictates to use care when brushing near the wounds for the first 2 to 3 days. Resume flossing the day after surgery as you are able. Do not use commercial mouth rinses, that is, Listerine scope, for the first 2 weeks. If you had lower wisdom teeth removed, you will usually be given a plastic irrigation syringe and shown how to use it at your post-operative visit. Activity. Avoid overexerting yourself and avoid strenuous exercise for at least 1 week. If you had IV anesthesia, go home and stay there for the remainder of the day. IV anesthesia may cause prolonged drowsiness. You should not operate an automobile or any other equipment or machinery. Nor should you plan to be responsible for children or make important personal or business decisions. Most people can return to work or school in approximately 3 days, and some will take longer. Swelling may take 1 week to resolve, and possible complications may prolong the recovery. Sutures. The sutures are self-dissolving and will come loose and fall out. The time varies from person to person. Typically, sutures last from 2 to 10 days. Do not be worried when the sutures come loose or fall out. Postoperative visits. After your surgery, you will need to return for evaluation and further instructions. It is important to attend to this visit. Typically, 1 visit after surgery is all that is required. Potential postoperative concerns. You may have pain which becomes worse after a few days and does not respond to the medication you are taking. This may be dry socket. Call the office to schedule a follow-up. Do not be alarmed if bruising, black and blue discoloration, appears on your face or neck after surgery. This will resolve without any intervention. This usually takes 1 to 2 weeks. Other teeth in your mouth may ache temporarily. Removal of wisdom teeth may trigger headaches. You may experience nausea or vomiting. This can be from the IV anesthetic medications, narcotic pain relievers, or antibiotics. You may develop a low-grade fever on the night after surgery. Numbness of the lower lip or chin may persist after surgery. Mention this at your post-operative visit. You may notice a hole in your gums after surgery. This is the tooth socket and it will fill in over the next 4 to 6 weeks. Food may become lodged in the sockets, especially the lower. If this happens, wound healing will be compromised and you will be at risk for developing dry socket and even infection. Clean with the provided syringe. Thank you for watching our post-operative instructions video. We hope you had a wonderful experience at our office. For further inquiries, please contact us